I'm talking to art therapist today, Kate Rothwell. Hi, Kate. How are you?
Hello, Joanne. I'm fine, thank you.
Great. Kate, today we're going to talk a little bit about art therapy. Firstly, what is art therapy and what is the aim of the art therapist?
Art therapy, in the most basic terms, is a form of psychotherapy. So I'm an art psychotherapist, but we combine art making with art materials with psychodynamic psychotherapy. So art therapists in the UK are trained using a psychodynamic model, which has a very broad umbrella, and it begins really from psychoanalysis, but we don't formally use psychoanalysis. We are primarily using the therapeutic relationship. And so if somebody is doing art therapy, again, in the most basic terms, it means that they are creating some sort of image, which might be using paint, paper, clay, photography, we've got animators now, in the presence of an art psychotherapist. So the primary objective is to develop a relationship, a therapeutic relationship. The difference being, though, that we will be considering also the art maker's relationship to their art. And the art is a term that we use, again, in the most basic form. It's not about high art, it's not about creating good art, it is finding a way of expressing something through art materials.
I think a lot of people initially think art therapy is just for children. Is this correct or not correct? Can adults also come for art therapy?
Art therapists can work with any age range, and in fact there are art therapists who even work with mothers who are pregnant, who can then work with the maternal relationship of the infant, the child, with the parent. And there's some very interesting work going on about that, which is about the maternal relationship and could be helping mothers or indeed fathers, carers with their relationship and their bonding with their infants. Actually, that's very fascinating work that's going on. Through to working with people right up to older people. Art therapists work with older people who have degenerative disorders or forms of dementia. So it goes right through from day one to the very last day, and obviously palliative care, working with people in the last stages of their life.
And does the therapist, how does the therapist interpret the artwork?
In fact, art therapists don't interpret the artwork, and the idea of, and I'm specifically talking about art therapists in the UK. I know in America art therapy I know it can be more diagnostic, and therefore if they're using diagnostic tools then it's likely to be more interpretive. But this is a common misconception about art therapy, I would say generally, which is that we can see things in the art that the maker might not be able to see, that we can read people's minds through their art, and that they are expressing something that we know about and they don't. But in fact, what I say to my clients is that, in fact, if I'm working in art therapy and somebody was to tell me what my image was about and to interpret it, I might be quite upset about that, particularly if it felt inaccurate. So in fact, the important thing is that through the therapeutic relationship, we are looking at what is made together, and also thinking about our relationship, our experience of being with the other person and with the image, and what we might understand about it together. So in fact, it's a very gentle therapy, but it's also very powerful because it can create very strong feelings, which any kind of projective technique can do. But we work very, very sensitively to ensure that we are thinking with the person and we are working at their pace and following them, and that we're not coming out with any surprises that they may not have seen for themselves. So we're actually working together, and it is a triangular relationship between the therapist and the art maker and the image. So our primary objective there isn't to interpret, but is to understand it together.
And what conditions can be treated with art therapy? Why would somebody come to an art therapist?
Okay, well, traditionally, art therapy is people who are trained as art therapists are trained to work in the public sector. So we are trained to work within institutions and organisations. And if we go back to when art therapy started, it was actually started in a hospital for men who were suffering post-traumatic stress syndrome after the Second World War. But we developed it from there so that we can actually work pretty much with anybody, and the list is infinite. So if I start with myself, I work in forensic settings, which means that I work with people, men and women, who have offended, broken the law in some respect, but and have been restrained, not restrained, but have been restricted. They are under sort of restraining orders so that they are in secure settings. So that's one way of working with people, and largely I'm referred people who also have mental health needs. They have perhaps they're suffering from some sort of psychosis, but then they may also be suffering from personality disorders, which has caused them to offend. So that's pretty much at the extreme end of the people we work with, and we work with people who are very, very ill. So it's a very common story, if you like, talking to art therapists, that they will say that they have been referred people that actually nobody else can work with, that they haven't been able to work with. But because of the non-verbal element of the art therapy, where it might be less threatening and they don't have the words to express themselves, and if they had, they may not be doing what they've done, the art will enable them to find a way of explaining what it is that they are feeling, or indeed to help them understand that they have feelings. So that's at a very extreme end of the spectrum, but we can go right through to people who perhaps suffer from affect disorders, who may be feeling depressed, or who may feel that they can't express themselves and are looking for another way of expressing themselves. It may be that we're working with people, if I was talking about children earlier, who are struggling with attachment disorders and haven't been able to bond well with their, with their carers, and are struggling at school to make relationships. There may be that with infants that perhaps they've been born with Asperger's or autism or developmental difficulties, and therefore need some other way of expressing that to understand their behaviour, to understand what it's like in their world and what's happening. And therefore the art therapist might become a sort of conduit to try and help them make sense of their world and help others make sense of what it's like for them. People who are suffering from physical problems, from cancer, I was talking about palliative care earlier. I am now working with people who have neurological problems, who have had both organic and acquired brain injury. And I also supervise therapists who work with people who have, they're working with people who have epileptic and non-epileptic psychogenic disorders. working with people suffering from schizophrenia, from obsessional compulsive disorders, anxiety disorders. I could go on. They're really, it's really down to the therapist and the client if they feel they can work together. That is what it comes down to. There are, I would say though, realistically, there are people that we can't work with who are not in a place where they're able to work with a therapist. And it may be that it's too soon for them and they don't know how to make use of it. And they're likely to be people who are still very much suffering with their difficulties and just need time perhaps to work, maybe to work in other ways. So I'm not saying art therapy is the only way of working. So I might then refer them, say, to a CBT therapist, and perhaps they need help with thinking skills or working in a much more basic way before they can come and work with an art therapist. But I have to say it's very, very rare for me to turn somebody down, and I know that's the case with other art therapists. What I would like to add to that, which you'll probably come on to about the training, is that we are trained, we are only trained at master's level. So a lot of art therapists have already done graduate courses, so that the training is highly skilled and requires people to come in with a lot of skills already, so that we're able to work in great depth.
Thank you, Kate. Thank you so much for talking to me today.
You're welcome.